I was fortunate to help assist with the breakout room for cancer across the age spectrum. So it was a really interesting breakout room. We had a range of speakers. One of the speakers was talking about young oncology patients and the kind of how they can, change the follow-up of these survivorship young oncology patients and what support they could install to help them. We also had a young and early cancer nurse, which is the MIG, the Members of Interest group that I sit under, that presented about prostate cancer and the impact of hormonal therapy on body image, which I thought was really impressive to see as well, because she's only a couple of years qualified. And also in the breakout room, we did have a couple of other speakers, one about kind of age and the impact. Actually, is it a myth that more elderly people are getting involved with digital kind of follow-up and platforms, and they're actually quite engaged in it, so that was really interesting to hear. And then we had one of the other people in the breakout rooms talk about a kind of end-of-life care, which I thought was really interesting, when a relative is end-of-life, and how to support the children in a training program they introduced, which looks really valuable. And me being in palliative care myself is something that I forwarded on to my team and my colleagues in the trust as well, because it's something that always requires kind of development and improvement of knowledge, and to also kind of give us confidence in having those conversations. So it was a really interesting breakout room, loads of good questions. So I'm looking forward to kind of seeing how their projects evolve now that, on the next step of their kind of research or quality improvement.